Hello everyone, and welcome to today's video. Before we dive into our topic, let's tackle some USMLE-style questions to warm up. These questions will help you test your knowledge on medication management in elderly patients. Ready? Let's go. 1. Which of the following is a key factor in the increased risk of adverse drug events in older patients? A. Enhanced hepatic metabolism. B. Decreased renal excretion. C. Increased muscle mass. D. Improved gastrointestinal absorption. Answer: B. Decreased renal excretion. 2. The Beers criteria is used to A. Determine the efficacy of medications for elderly patients. B. Identify medications that are potentially inappropriate for older adults. C. Establish the dosage of medications for elderly patients. D. Monitor drug interactions in elderly patients. Answer: B. Identify medications that are potentially inappropriate for older adults. 3. What is a common issue associated with polypharmacy in older adults? A. Improved drug efficacy. B. Decreased risk of drug interactions. C. Increased risk of adverse drug events. D. Enhanced drug absorption. Answer: C. Increased risk of adverse drug events. 4. Which strategy is not recommended for preventing adverse drug events in the elderly? A. Educating patients and caregivers about medications. B. Regular monitoring for side effects. C. Ignoring potential drug-drug interactions. D. Keeping an accurate list of all medications. Answer: C. Ignoring potential drug-drug interactions. 5. What is a key principle of rational drug prescribing for elderly patients? A. Prescribing the highest dose possible. B. Regularly updating and reviewing the medication list. C. Avoiding any medication changes. D. Relying solely on patient self-reporting of medication efficacy. Answer: B. Regularly updating and reviewing the medication list. Now, let's delve into the complexities of prescribing for older patients. As people age, their bodies undergo several physiological changes that can significantly impact how medications work. These changes include alterations in drug absorption, distribution, metabolism, and excretion. For instance, aging often results in decreased liver and kidney function, which can lead to reduced drug clearance and increased risk of toxicity. A major concern is polypharmacy, which is the use of multiple medications by a single patient. This is common among older adults due to their complex health conditions. With more medications, there's a higher risk of adverse drug events and interactions. The presence of multiple chronic conditions often necessitates a variety of treatments, complicating medication management further. The Beers criteria, developed by the American Geriatrics Society, is a valuable tool in this context. It helps identify medications that are potentially inappropriate for older adults. These guidelines are crucial for avoiding drugs that may be ineffective or pose a high risk of adverse effects in the elderly population. Using these criteria helps healthcare providers choose safer medication options. Adverse drug events can stem from several factors. Polypharmacy. Use of inappropriate medications. Underutilization of appropriate drugs. Transitions between different care settings. To prevent these issues, it's essential to educate elderly patients and their caregivers about proper medication use. Providers should always take a comprehensive drug history and apply quality measures in prescribing practices. This includes avoiding inappropriate medications and ensuring that necessary drugs are used correctly. Regular monitoring for side effects and drug levels is crucial. Additionally, preventing drug-drug and drug-food interactions is important to avoid complications. Engaging patients and their families in the medication process is also key. Maintaining an accurate list of all medications, checking medication containers periodically, and educating patients about drug names, both generic and brand, can help mitigate risks. It's important to be aware of potential drug confusions, such as look-alike and sound-alike names. A useful approach for managing medications in elderly patients involves using a checklist to verify that each medication is necessary and effective. This checklist should cover: clear indication for the medication, effectiveness of the medication, any side effects experienced, routine adherence to the medication, need for lab monitoring, ongoing necessity of the medication. Principles of rational drug prescribing for elderly patients include: periodically updating and reviewing the medication list, collaborating with community pharmacists, educating patients about their medications, considering adverse drug events as possible causes of new symptoms, simplifying medication regimens, starting medications at the lowest effective dose. By adhering to these guidelines and principles, healthcare providers can better manage the complex medication needs of elderly patients and reduce the risk of adverse drug events. This approach not only improves patient safety but also enhances the quality of care for older adults. Prescribing for older patients presents unique challenges due to age-related physiological changes and the increased risk of adverse drug events. These challenges are primarily attributed to alterations in drug absorption, distribution, metabolism, and excretion that occur with aging. Additionally, changes in body composition, renal and hepatic function significantly impact drug levels and the risk of adverse effects in the elderly. One major issue is polypharmacy, or the use of multiple medications, which is common among older adults due to their often complex health conditions. The more medications prescribed, the higher the risk of adverse drug events and interactions. This risk is compounded by the presence of multimorbidity in elderly patients, who often require a variety of treatments. The Beers criteria, established by the American Geriatrics Society, provides a guideline for identifying medications that are potentially inappropriate for older adults due to their ineffectiveness or high risk of adverse events. This list helps guide healthcare providers in selecting safer medication options for elderly patients. Adverse drug events can result from several factors, including polypharmacy, the use of inappropriate medications, underutilization of appropriate drugs, and transitions between different care settings. Effective management aims to prevent such events through a variety of strategies. Preventive measures include educating both elderly patients and their families or caregivers about medication use. Healthcare providers should take thorough drug histories and apply quality measures in prescribing practices. This involves avoiding inappropriate medications and ensuring the appropriate use of indicated drugs. Regular monitoring for side effects and drug levels is crucial, as is preventing drug-drug and drug-food interactions. Engaging patients and their families in the medication process, maintaining an accurate list of all medications, and conducting periodic checks of medication containers can help mitigate risks. Patients should be made aware of potential drug confusions, such as look-alike and sound-alike drug names, and should be informed about both generic and brand names of their medications, including their purposes. A useful approach for managing medications in elderly patients involves a checklist to ensure that each medication is necessary and effective. This checklist should address whether there is a clear indication for the medication, if it is working as intended, if there are any side effects, whether the patient is taking it routinely, if it requires lab monitoring, and if it is still needed. Principles of rational drug prescribing for elderly patients include periodically updating and reviewing the medication list, collaborating with community pharmacists, educating patients about their medications, considering adverse drug events as potential causes of new symptoms, simplifying medication regimens, and starting medications at the lowest effective dose. By adhering to these guidelines and principles, healthcare providers can better manage the complex medication needs of elderly patients and reduce the risk of adverse drug events, ultimately improving the quality of care for this vulnerable population. Thank you for tuning in. If you found this video helpful, please like, subscribe, and hit the notification bell for more content on medical topics. Leave your comments and questions below. I'd love to hear from you. See you in the next video.